Okay, this video is to demonstrate how to help heal your sciatic and back pain by using a foam roller and then some stretches. This foam roller is a little funky, so if you've got the straight roller, then use that because it's going to be a better fit for these exercises I'm going to show you. So the first thing that I want to explain is how to foam roll your glutes and really why it's important and effective to do this. Your glute muscle is a rather large muscle in the back and when it's tight, it can pull at the lower back and it can also pull at the hamstring. So it can kind of cause pain going down the leg, and that's where the sciatic runs. So the first thing is actually sitting on your foam roller. So again, if you've got that straight one, you're just sitting flat on it. And then whichever side is causing you pain or irritation is the side you roll into. So you can either put your legs straight and roll forward and back over the largest part of the glute muscle, so glute maximus, or if you need a little bit more dig in, you can bring the leg up. So I've got my foot on top of my knee, and then I'm just rolling forward and back again on that muscle, and just taking slow deep breaths. I would do 30 seconds on this side. So again, just to kind of show you, I'm on the largest part of the glute here. I'm not, on the side. I'm really on the main part of that muscle. The second thing you want to do is to roll out a little bit of the upper back. Sometimes too, when we have tension in the upper part of the spine, it tends to pull at the rest of the back downward. We don't want to foam roll the lower back. The lower lumbar spine is a little bit more, it's not fragile because it has larger parts to it, but at the same time, we don't want to put so much pressure on that space when it comes to foam rolling. So I highly recommend just doing from the middle of your back, so kind of where I'm starting here, and then hands back behind your head, and just rolling forward and back on that part, especially if you are sitting at your desk and leaning forward, hunching forward and feeling the strain and pull at the neck and the upper part of your back and your trapezius muscles. So I'd roll back and forth for 30 seconds on the upper part of your back. So definitely do those too. You can also take an Epsom salt bath, or you can do the foam rolling or exercises when your body is warm after you've already gone for a walk or done a little bit of movement, depending upon how severe the back pain is for you and the sciatic pain. So the foam roller is a great tool you can do on a completely cold muscle, or you can do it when your body is already warmed up. The other stretches that I want to show you, so grabbing a mat here, I've got 6 more to show. So the reclining pigeon pose. So this is where you're coming down on your back. You're bringing your foot up and your leg is just coming into this figure 4 position. Then as you make your way into pulling at the back of your hamstring, you're just going to kind of first, I like to kind of just shift around my hips, just feel that stretch here. So again, in the glute that's pulling, this is usually where it's sciatic, right? This is running back here. And then I'm going to take a nice deep breath in and an exhale. Grab underneath my leg and hold it here. So I'm just going to count for 30 seconds, holding this position and breathing deeply. Trying not to tense up here or tense up here. You're really just trying to relax the knee, relax the back, and almost envision as you breathe in that you're creating more space for the nerve, you're creating space for the muscle, you're creating space for the joint, the hip joint here. So breathing slowly through. So that's the first one you do. I would do both sides too. I mean, even if you've got pain only on one side, a lot of times there can be pull from one direction, but you feel the pull on the other side. So I would still do both sides. So again, this is the pigeon stretch, lying down, reclined position, grabbing behind the thigh. And again, you probably won't feel it as much on that side, or maybe you do feel it on both, but I would do both sides just to be safe. All right, then the second one is sitting straight leg pigeon pose. So this one, you want to sit up tall. So you've got your legs straight out in front of you. You've got this foot coming up here. So again, you're creating that figure 4. lightly press on the knee. My back is nice and straight. And then I'm gonna lean forward. So notice how I'm not like collapsing and I'm not like rounding my shoulders here. I'm keeping everything really upright and then leaning forward. You're gonna feel that again in the hip. You're gonna feel it right in that spot that you've been feeling sore, tenderness, and just take some deep breaths here. If it's uncomfortable to have your ankle, just find an ankle on your foot, just kind of find a comfortable space and then lean forward. Again, do both sides. It hurt to do the other side here. You might feel a little bit of shifting in your hips, or you might feel a little bit more tightness on one side over the other. The next one is the forward pigeon pose. So now we're going to take it into a kneeling space and we're going to put one leg forward. So again, if this is the side that's bothering you, we're going to take the leg forward like this and then in. I'll do both sides so you can see. So my back foot is flat, that you can't see on the floor. My quad is to the floor and I'm pushing my hip down. You can also bring your elbows down to the floor. And again, just getting that stretch in the back of the leg here, as well as down the IT band and then the side. Let me show you what it looks like from the inside space. If I'm doing this leg, I've got this foot here, coming down and stretching out this side. And then you can also lift up from here and sit up tall. I am currently at 17 weeks pregnant, so I'm not really going back too far here, but you could go back a little bit further to get a better lift and a better stretch. The next one is knee to opposite shoulder. So this one, you're back laying down, and you're gonna bring your right knee to your left shoulder. So I'm first just gonna draw the knee, because again, take your time getting down to the floor. You don't wanna do any sudden movements, because those sudden movements can be what twitches the back into a comfortable space. So as you're bringing the knee in, I'm just gonna hold it here. I like to kind of wiggle it around, find that space where it feels good. Take a deep breath in, then take that knee over and across, like you're pulling it over and up at the same time. Should feel a deep stretch in the glute and the side here, and I'll show you from the other side so you can get the other perspective. Okay, then slowly I would keep this knee here before you transition and bring the other leg in. I wouldn't lower this one down. I'd keep it in and then slowly lower that one down. Okay, so to show you from this side, get this knee and I'm gonna pull up and over. And again, here's where I'm feeling it. I have a little bit of a belly in the way, so you won't have that to deal with, but just pull up and diagonal. Okay. And then next one is sitting spinal stretch. So just gonna get up safely here for the back. So sometimes if you come into fetal position and then you press up with using your tricep to get up in this spot, and then sitting up tall, go ahead and bring the leg in, and you're gonna bring it to the other side. You're gonna take your hand back. You can either hold on to your knee or you can put your elbow against the knee, and then you're just gonna spinal twist. I usually do this where I push my elbow into it and then I twist a little bit further. Again, you'll probably get a little bit more rib expansion than I'm able to do currently at this phase in my life, but just to kind of give you an example. And then this way, this side, twisting. Okay, next exercise is standing hamstring stretch. So this is where you're gonna wanna have a chair or a stool or something out in front of you so that you can put the foot on top. So I've just got my chair here and I'm gonna put my foot here in front, and then you either stand up tall or you're reaching towards the chair, but I'm still keeping my back flat. We don't wanna hunch over or cave in with the spine, because that's gonna pull directly at the lower back and not feel like a good stretch. So try to keep the back upright. Stretching the back of the hamstring is another great spot to help relieve tension in the sciatic nerve. So I would do this and just breathe into it and hold it for 30 seconds. Again, you're doing this when your muscles are warm. So either whether you're getting out of the bath, you've done some foam rolling, you've gone for a walk, you've done something that holding a static stretch will allow your body to really move into that space carefully and safely. The other one that you can do is bending the knee and then moving this leg back and pushing down into it. This again is another way to stretch out the hamstring and the glute, and you just push forward into the chair. So those are all the stretches for your sciatic, for getting a little bit more movement and mobility in that area to help relieve back pain, to get you in a more comfortable state, and to help heal the pain that you're dealing with. Let me know if you have any questions.